More on the shocking death of Stephanie Kuliba, the 18-year-old who died more than a week ago after going in for breast surgery. NBC's Carrie Sanders has more on her story.
18-year-old Stephanie Kuliba, high school senior, head cheerleader, a popular girl among the popular on campus. She went into a Boca Raton plastic surgeon's office 10 days ago for corrective breast surgery and augmentation. While under anesthesia, there were complications believed to be the result of a rare genetic anomaly, malignant hypothermia, the uncontrolled overheating of the body. This is part of the 911 call made that day.
We think it's malignant hypothermia. Is she breathing? I think they are, yes, she is. Is she conscious? I know, she's been sedated. She was having surgery.
The Kuliba family attorney says medical notes from the doctor, Stephen Schuster, the anesthesiologist, Dr. Peter Warheit, and the nurse reveal a critical flaw, not enough of the one drug that might have saved her, dantrolene.
The amount of dosage that they said they gave was wholly insufficient to treat this girl.
Dr. Schuster's lawyer says Dr. Schuster did everything he could and responded to her in an appropriate and timely fashion, in accordance with the standard of care in the operating suite. The anesthesiologist had no comment.
Doesn't make sense to me why someone so amazing that made such a difference in so many people's lives is gone, though. It's never going to make sense to me.
Stephanie's cheerleading coach and best friends fear people will draw the wrong conclusions when they hear a high school senior was having plastic surgery.
This is not an 18-year-old trying to get bigger breasts. Absolutely not.
It wasn't a boob job. It was a corrective surgery of a birth defect that she had since a child, and even in the locker room, even anywhere she would change, she was self-conscious about it.
Stephanie's friends say she hoped to one day become a doctor. Those same friends now say they hope that what happened to Stephanie will wind up leading to changes in medical practices. And if that happens, Stephanie will wind up saving lives as she would have if she had become a doctor. For today, Carrie Sanders, NBC News, Boca Raton, Florida.
Tom and Joanne Kuliba are Stephanie's parents. Chris is her brother, and Roberto Stanzial is the family's attorney. Good morning to all of you, and let me offer my condolences. I'm so sorry for your loss, and I appreciate you coming to talk to us today. I mean, this news had to come as such a shock. Why don't we first of all talk about the exact reasons why Stephanie went in for this procedure?
Ever since Stephanie was born, she had a birth defect, and she was extremely self-conscious of it all of her life. And it became more and more an issue for her as she grew into her teenage years.
So as she was about to go to college, she decided this would probably be a good time to do this. Were you all in favor of her getting this done?
Well, we were supportive of her decision. Obviously, it was something that was so important to her that she made the decision, and it was critical for her. The timing was impeccable because she was off from cheerleading. She was about to go off to college, and it was the right time as she made the next transition in her life.
Talk to me about research. How did you decide where it should be done, which doctor should do it, hospital or outpatient clinic, that sort of thing?
We did extensive research on plastic surgeons within the area, and her plastic surgeon became highly recommended to us. And
this is Dr. Stephen Schuster.
Absolutely. And we visited the facility, which was an amazing facility, state-of-the-art facility, state-of-the-art surgical suite, and we felt confident based on the recommendations that and his credentials. He was a board-certified plastic surgeon. He had registered nurses on staff that were on staff and part of the surgery. So it was absolutely, we felt confident that this was the right decision.
Tom, had you ever heard of something called malignant hyperthermia?
Absolutely not. When I arrived at the emergency room, and we were waiting for about an hour before we can get any information about the disposition.
Well, let me just interrupt. During the procedure, they said there's a problem. They needed to get her from the clinic to an actual emergency room, right?
Correct.
And you got there. Go ahead. I'm sorry.
When I arrived, it was about an hour before they would come up and give us any information about her status. When the doctor finally came out, the surgeon himself, he indicated that it was a rare genetic disorder called malignant hyperthermia. And from there, thank God, the technology, we had a computer right there. We began to do our research and learned immediately how grave a situation this was potentially going to become.
Roberto, according to records that you've obtained so far, you contend that Stephanie was not given enough of the medicine called dantrolene.
Dantrolene. That's correct, Matt. You know, basically what happened to this girl in the surgical suite, they might as well have just had a couple of auto mechanics in there. This is how these doctors reacted. And, you know, I just saw the comment that Dr. Schuster's attorney said they lived up to the standard of care. I've spoken to so many experts, and all of them have told me the same thing. This girl did not have a chance in that clinic. They were not prepared, didn't have the people, didn't administer enough medicine.
And yet you've heard Stephanie's mom say this was a state-of-the-art clinic. You walk in this place, it looked fantastic. Let me just read you a portion of what Dr. Schuster released in a statement. It says, Dr. Schuster did everything he could and responded to her in an appropriate and timely fashion in accordance with the standard care in the operating suite. Dr. Schuster and Dr. Peter Warheit, who's the anesthesiologist, have worked together for several years and performed operations like this without incident.
That is absolutely ridiculous, Matt. It really is. There is a standard of care of how you treat a person that you believe is going into malignant hyperthermia. The standard of care is set out. It's by the Malignant Hyperthermia Association of the United States, and it is delineated what procedures are supposed to be followed, how much of the medication is supposed to be given. Matt, I am telling you, these records show these guys did about 1/10 of 1% of what was supposed to be done.
I just want to go back in hindsight in this case, tragically 2020. You look at the options of going to an outpatient clinic, a surgical suite, or a hospital to get this done. Your message would be what?
Well, going forward, and you know, unfortunately, our family is victim, and poor Stephanie has paid the price. Going forward, there's such a lack of information that is provided to you when you get into this setting. It's more or less being handed a form and kind of complacently being told that there's a risk. But there's so many things in which really need to be brought to people's attentions with regards to the options that you might have in this setting. And not only the options of the medications that you could be prescribed for sedation, but also the choices that you should be able to have to elect where this procedure might be performed.
We're going to follow this case. But Chris, can you do me a favor? Can you tell me a little bit about Stephanie, about your sister?
Sure. I mean, not just coming from her brother, but she honestly was one of the most selfless people I've known. Growing up when she was young, it honestly made her happy to make other people happy. And her friends have told me that she looked up to me and idolized me, but honestly, I looked up to her, and she taught me how to live life.
As I said, we're going to follow this story and find out what happens legally, and obviously it's important to get the more medical side of this out to people, to the Kalibas. Thank you so much, and again, my condolences.
And may I ask the public to visit www.stephaniejudekaliba.org, where we've been able to, our friends who have given us tremendous support, have put a website out there that will enable the information to learn about this horrible situation.
Thank you again, Mr. Stanzial. Thank you very much for your time. I appreciate it.
Thank you very much, Matt.